Hello, this is Danny Blyth from the College of Integrated Chinese Medicine, looking at what to do if you don't get deqi. This is for acupuncture students only. Please pause and read this. The first things to consider are, is your point location and depth correct? And if it is, then we usually use lift and thrust, which I've shown before. We can focus our intent on the needle tip, or we can needle the other side, and that will often bring deqi on the original side. So lift and thrust we've discussed before. With lift and thrust you're going directly up and down the shaft of the needle, not changing the angle, just the depth. With rotation the needle stays still, but you're rotating it forwards and backwards, making sure to go one way and then the other so that you're not entwining the muscle fibres and causing pain. Scratching or scraping, make sure you don't touch the shaft of the needle. Support the needle with your index finger and scrape with your thumb, or the other way around. Needle flicking, just like it sounds. If you've got lots of needles with different lengths you can make a song. No, I'm joking. I usually flick in the direction that the chi's moving in. Searching is like lift and thrust, except you change the angle of the needle. So I use this in fleshier places and for Asha points. Shaking and trembling, just like it sounds, you're using a very fine lift and thrust. Very gently manipulating the needle. This is good if lift and thrust is a bit too strong. Flying involves rotating the needle and immediately letting go. I don't use this a lot. Make sure that you wind the needle the other way around if you're rotating it. And following involves massaging above and below the channel in the direction of the flow of qi. This is good for deficient patients especially. You can use needle rotation. I'll often use that areas over the lungs or delicate areas where I don't want to do lift and thrust. You can do needle scraping or scratching with your fingernail, only on copper wound handles. You can use needle flicking. You can use searching, where you change the angle and the depth of the needle, like lift and thrust but moving around. You can do shaking and trembling, gently vibrating the needle. Flying, rotating the needle and quickly releasing. If you do that, make sure that you rotate the needle back the other way so that you're not winding the muscle fibres up in the needle. And following, where you massage above and below the point. Remember to use clean needle technique and don't touch the shaft of the needle.